Hello everyone, welcome back to our channel Dentistry to the Point. This is Dr. Drumil Manik. So in the previous video of general surgery, that is the lecture 1, we discussed about the types of wound, that are the various types, that is the closed wounds as well as the open wounds, right? So now in the lecture 2 or the second video of this subject, we are going to discuss about the components which are going to play their role in the mechanism of wound healing, right? So this question again might be asked as a short note or along with the type of wounds as a long answer also, right? And it is also a basic concept which should be in the mind whenever you are going to sit for a NEET PG entrance exam, or it may be your final examinations of your third year, right? You have already studied the elaborated version or the cellular mechanism or how the wound healing takes place in the second year, that is general pathology, that is the wound healing, that is healing by primary intention as well as by healing of secondary intention. But here we are not going to discuss about healing by primary intention or healing by secondary intention. First, we are going to discuss about the basic components which are going to play the role in the mechanism of wound healing, right? So without wasting much of a time, we'll start with the components of the wound healing, right? Okay, so but after the intro. So now starting with the components of wound healing, there are mainly 4 components which are involved in the mechanism of wound healing, right? So first one is the inflammatory phase, second one is the proliferative phase, third is the remodeling phase, and fourth is the phase of scar formation. I hope so this all phases are clear and you might have heard about all these phases before also. So now the name itself of all these phases signifies that there is something related to occurring some events are going to occur related to these names. So if we talk about the inflammatory phase, we can predict or we can assume that there will be role of inflammation or inflammatory mediators. Then we have proliferative phase, that is there is proliferation of new cellular and vascular components in the area where there is tissue injury. Remodeling occurs once there is proliferation of the cellular and vascular events, and lastly the wound will resemble last when it is almost about to heal or it is healed, it will represent as a phase of scar formation, right? So these are the 4 phases, or you can also call it as components of wound healing. So now next, moving on, before starting with all the 4 components, this is just a brief blueprint or a mind map which you should remember as basic. So if you start with the very first thing, that is on the top we have tissue injury, right? So whenever there is occurrence of tissue injury, there will be release of platelets. So now as soon as there will be release of platelets, they are going to adhere, they are going to aggregate and form 2 things, or there will be occurrence of 2 main events. First basic thing, wherever there is going to be bleeding injury, there is going to be formation of clot, right? So formation of blood clot is the basic mechanism which the body is going to first establish whenever there is an injury. So now when there is formation of clot, along with that you have release of some chemical mediators of your inflammation also, right? So these are the 2 main events which are going to occur, that is formation of clot as well as release of chemical mediators of inflammation. So now when we focus on the chemical mediators of the inflammation, they are responsible for the occurrence of 2 main changes. The 2 main changes are the vascular changes as well as the cellular changes. Now vascular changes are those changes which are going to take place in the vessels itself, and cellular changes, as the name again signifies, they are the changes which occur at cellular level. Okay, so now first the vascular changes, the main change which will occur when there will be a tissue injury, that is vasodilatation of that vessel. That vessel is going to dilate. So now whenever a blood vessel is going to dilate, what will happen? You have studied about the 5 cardinal signs of inflammation, right? The 5 cardinal signs of inflammation are given in the textbook of general pathology, essentials for dental students, on the very first page of the chapter inflammation. There are 5 cardinal signs, that is rubor, calor, dolor and tumor, and last fifth one is loss of function, right? So these are the five cardinal signs from which erythema, that is redness in the area. So now as soon as there will be vasodilatation, there will be redness in that area, whether it may be an internal injury or if it is an external injury, there is always going to be bleeding, right? Next is increased permeability between the intravascular as well as the extravascular components, or the cellular as well as various components present. So there will be increased exchange between the intravascular as well as extravascular components, and lastly there is increased blood flow. So as soon as the vessel dilates, we have three things. First, if the blood is flowing, the flow is going to increase. When the flow is going to increase, there will be redness, and lastly there will be increased permeability between the intravascular and extravascular contents, right? So now when there will be increased blood flow, the cells which are going to flow intravascularly are also going to increase. So there will be increased number of circulating cells, right? So now we are transitioning from increased blood flow to cellular changes. I hope so you guys are following the flow chart. Okay, just listen to me and follow the flow chart. So increased circulating cells. So now we have moved on to the cellular changes. Now cellular changes is like there are neutrophils present, where whatever the content of the blood which is present intravascularly, there are neutrophils, monocytes, lymphocytes. These are going to play their main role, right? So now neutrophils as well as monocytes, which are going to turn in future as modified monocytes, you can call it as macrophages, which are in total going to cause phagocytosis, right? Now what is phagocytosis? We are not going to go detail into that. And we have on the other hand, that is lymphocytes, that are our immunity or fighter cells, which are for the protective mechanism, right? So immunity cells, or their production, they also cause production of antibodies which help us to fight against various antigens, right? So in total, this is just a brief mind map what happens exactly after the injury. Now what are the components and what they do in the event of wound healing? We are going to discuss it further, right? So I hope so you guys are clear with this flowchart from tissue injury to release of the cellular components like neutrophil, monocytes, macrophages and lymphocytes, right? So now next, moving on to our very first component of our inflammatory phase, right? So which is the very first component of inflammatory phase we'll study. So as soon as the injury results, there is release of mediators of inflammation. As I said previously, there is release of chemical mediators of inflammation, right? So whenever there is release of chemical mediators of inflammation, like this is the center photo or the picture which you see just beside the heading of inflammatory phase, that is we have written, it is written clearly that the very first mediator which will be released from mast cells, basophil and platelets, that is your histamine. So mainly histamine is going to be released from the platelets. We saw platelets were released as soon as after the injury, right? In this flow chart you saw that release of platelet. So now these release of platelet is going to cause what? It is going to cause release of chemical mediators of inflammation, that is your histamine. Now what is your histamine gonna do? Your histamine is going to increase the permeability of the vessel. As I said earlier, there will be increased permeability of the vessel between the intravascular as well as the extravascular contents of the body, right? So first thing what will happen is, as soon as injury is going to occur, there is going to be release of chemical mediators of inflammation. After the flow chart, that is clot formation, then there will be release of inflammatory mediators like basically histamine, which will be released from mast cells, basophil and platelets. Now what they cause? They are going to cause increased permeability of the vessel. Later what will happen is kinins as well as prostaglandins also will be released. Now what does this prostaglandins do? Prostaglandins are going to help you in dilatation of your vessel. So the two requirements which were mainly essential when there is wound healing or after an injury, that is increased permeability and vasodilatation, which were occurring in the previous flow chart which we saw that are going to be fulfilled in this phase itself, that is increased permeability by histamine and vasodilatation by your prostaglandins. Now later what will happen is, when there is release of this chemical mediators of inflammation, they act and they play as a chemotactic role for the white cells, that is your white blood cells, as well as the fibroblasts. So now if the fibroblasts from the extracellular component, if they want to enter into the vessel, they need the process that is chemotaxis, the transfer of your neutrophils from vessel to outside, right? Or the neutrophils are your white blood cells, or it may be fibroblasts. So that process is known as chemotaxis. Now prostaglandins help to conduct this process of chemotaxis, so they are considered to play as a chemotactic role for your PMNs, that is polymorphonuclear neutrophils. Ultimately they are your white blood cells and as well as the fibroblasts. So first what will happen, histamine will be released, जो कि will increase your permeability. Prostaglandins will increase your dilatation. Later what will happen is they will in turn help in transfer of these cells which are present in the vessel to move outside the vessel. So this is going to occur for first 48 hours. जैसे कि for example if you are injured today anywhere on your skin, so for the first 48 hours what will happen is your polymorphonuclear neutrophils, or you can say as white blood cells or leukocytes, are going to dominate. PMN, P stands for police. So whenever an event or any accident or anything occurs in your city or nearby in your hometown, what will happen is first thing will come is police. They are going to come and inspect whatever the thing has happened. So you need to remember in that way. First 48 hours they are going to investigate the situation. So in that way PMNs are going to come and dominate in that area for the first 48 hours. What they do? They play the role of scavengers by removing the dead and necrotic tissue. Why dead and necrotic tissue? Because if there is an injury, that part of the body or that tissue will be deprived of blood supply, because if there is injury to the blood vessels, or if the blood vessel or oxygen supply is not proper, that tissue might become dead. That is, irreversible cell injury might occur, right? So when there is cell injury, what will happen? The tissue will get necrosed or it will become dead. So what they will do, they are going to scavenge, they are going to lift everything and dispose it. That is the work of polymorphonuclear leukocytes or neutrophils. So what does the police do? Whatever the things has happened, accident, the bodies, everything, they will come, they will inspect, they will call the ambulance and they'll clean that area so that it doesn't affect the normal public. I hope you guys are able to relate the story of police accident and everything with this thing. It is easy to remember, trust me, right? So now first stage is your inflammatory phase. Inflammatory phase mein what happened? Histamine came, prostaglandins came. What they did? They increased the permeability, they increased the dilatation. So once the dilatation is increased, what will happen? Chemotaxis will happen. That is, the neutrophils are going to go from the vessel, outside the vessel, to inspect the area where injury has occurred. Once they have inspected, they are going to clean that area. So this thing is going to happen for first 48 hours. I hope so till now you guys are clear. On the right hand side of the screen, you can see a flow chart. This is just a brief overview. So for example, first thing what will happen is a wound, right? So wound, as soon as it will happen, there will be bleeding. Inflammatory phase is going to start, right? Once the bleeding is arrested, there will be again vasoconstriction, that is, everything, clot and all is formed, vasoconstriction, thrombus is formed, hemostasis is achieved, that is, the bleeding is stopped, platelets are released. Okay, now once the platelets are released, now these platelets have some factors which are going to play their role, and these factors are going to attract the police, right? So platelet derived growth factor, platelet factor 4, and transforming growth factor beta, right? So these three factors are as your civilians which are present at the accidental site, right? So these civilians are going to call the police, that is your polymorphonuclear neutrophils as well as macrophages, which are going to help to clean up the area of dead and necrotic tissue. This is clear? Okay, if you guys have any doubt regarding this, just let me know in the comments section. Okay, we'll move forward to our second phase, that is your proliferative phase, right? Now what is the proliferative phase? Now between you have ended 2 days, 48 hours are over. Now moving on to the third day after the injury or wound, right? So between third and fifth day, the polymorphonuclear leukocytes are going to diminish. That means the police is going to go and something else is going to come. Now what is going to come? That is monocytes. The monocytes are again your white blood cells, right? Leukocytes. So they are going to increase in number. Now the role of police is over. Now you will have is monocytes. So by 5th or 6th day, as I said, neutrophils as well as monocytes are going to help you clean up the area of dead and necrotic tissue, right? So now by 5th or 6th day, the fibroblasts appear, they proliferate and give rise to protocollagen, right? As I said, with PMNs, fibroblasts were helped by prostaglandins to play a role of chemotactic, right? Chemotactic process, right? So PMNs and fibroblasts, both of them came outside the vessel. Now fibroblast is going to play their role in 5th and 6th day, and what will they cause? They'll proliferate and eventually give rise to protocollagen. Now what is the importance of this protocollagen? Protocollagen, in the presence of protocollagen and hydroxylase, and with the process of hydroxylation along with the addition of ferrous ion Fe2 plus ions, they are going to form collagen. Now this collagen will help to form more number of fibroblasts and collagen fibers in the wound area. Okay, now why is this collagen important? I'll tell you just a second. So now fibroplasia. Fibroplasia is what? There is more number of fibroblasts in this region at 5th and 6th day. Don't get confused. If you're not able to remember it, I would suggest watch this video twice or thrice. I swear that you will not forget this anytime, right? So now fibroplasia, that is increased number of fibroblasts along with capillary budding. Now see, wound has occurred, bleeding has stopped, clot has formed, clot came, polymorphonuclear neutrophils, monocytes, everyone came, they cleared the area with dead and necrotic tissue. Now we have our fibroblast playing their role, right? So fibroblast as well as capillary budding. What is capillary budding? Wherever there is tissue injury, there is cut off of the blood supply, right? So now to establish the new blood supply in that area, there will be formation of new capillaries. So increased number of fibroblasts plus more number of capillaries give rise to the formation of granulation tissue. You already have your inflammatory cells, inflammatory mediators, fibroblast, collagen. So this all complex will form a granulation tissue. Granulation tissue is always formed in chronic inflammation, not in acute inflammation, right? This you should not forget. So fibroplasia along with capillary budding gives rise to a granulation tissue. Now this granulation tissue, what will it help in? So on the right side top corner, you can see a diagram. Now you might be thinking that why sir has put this diagram of concrete slabs and ceiling or construction site in the topic of wound, that is components of wound healing. So here you can see rods or bars, along with that water is used and cement is used, right? So this is the main mixture, or these are the main components which are used in proper fabrication or construction of a ceiling of your house or any building, right? Or pillars. So what will happen is you just assume that these rods are your fibroblast and collagen fibers. The cement which is used over here is your mucopolysaccharides which are released by your collagen. Okay, so mucopolysaccharides, mucopolysaccharides released by collagen, your collagen fibers and fibroblasts which are going to resemble the rods, and the ground substance or the water. These three are going to form a firm base to heal the wound. So as we are going to form a firm base or ceiling in the houses, in the same way in the process of wound healing this will also happen. So you have your collagen fibers, you have your mucopolysaccharides as your cement, and rods as your collagen fibers, and water, that is the ground substance. The mixture of all the three will help in form a proper base for the healing of wound, right? So once this is done, now what will happen is from the base of the wound, for example the wound is V-shaped, right? So from the base of the wound the epithelialization will start, that is the formation of new epithelial cells will start. So that is going to start from the margin of the wound, not anywhere in the center area, the empty gap. Always the wound healing is going to start from this margin and this margin. Eventually it will go up and close the space. So this is the proper process of wound healing. So epithelialization occurs mainly from the edges of the wound by a process of cell migration and multiplication. Now any cell which if there is initiation, there will be migration of cell. Eventually that cells are going to multiply and close the gap between the two edges. I hope so this is clear. Now this is mainly brought about by your marginal cells, because if the epithelialization is going to occur from the margins, obviously the cells responsible are going to be the marginal basal cells. So now by after the 5th and 6th day, within 48 hours, the entire wound will be re-epithelialized. Okay, so here we are at the end of 7th day. Again, now all the days, all the processes, this is for a basic wound, right? Now if you are dealing with a complex wound or a larger wound, the timing is going to vary according to the size and severity of the wound also. Okay, but you need to know the basic mechanism what is going to occur. So now first 2 days, pulleys, that is your polymorphonuclear neutrophils. After that, 3rd and 5th day you had your monocytes. 5th and 6th day you had fibroblast, which gave rise to protocollagen. Protocollagen became collagen. Collagen helped us to give mucopolysaccharides. So ultimately fibroblast, mucopolysaccharides, collagen fibers and water and ground substance, everything formed a firm base. Once the firm base is laid down, now this marginal cells are going to migrate and multiply to close the wound. So this is your proliferative phase. There is proliferation of various components occurring in this phase. I hope so you guys are clear with the second phase. Now next, moving on to the third phase, that is your remodeling phase. Now whatever is laid down is going to be remodeled into a proper structure, right? Because wound healing is to be done simultaneously. There is proliferation as well as remodeling of that area. So now this is brought, now this remodeling phase is mainly brought, or it is responsible by fibroblast. Fibroblasts are the main agent which are going to play the role in remodeling phase, right? Because of their contractile elements. Now these fibroblasts have some contractile or specialized contractile elements which we call it as myofibroblast. Myo stands for muscle. Okay, so now these contractile elements, what will they do is they are going to contract. So as you know, there is abundance of fibroblasts present everywhere. So directly there will be abundance of myofibroblast also. So when there will be abundance of myofibroblast, there will be contraction of the wound. Now why does this contraction of the wound occur? This contraction of the wound occurs because it is the nature's way of reducing the size of the defect, right? If the defect is so big, the body will have to deposit so much of content, right? But eventually after deposition of some amount of content, that is fibroblast, these myofibroblasts will contract. So when they will contract, they will reduce the size of the wound. Okay, so it is nature's way of decreasing the size of the wound so that wound healing takes place faster at a faster rate, right? So wound contraction occurs when there is loose skin. In your body there are places where the skin over any anatomical part is loose. Like in your gluteal region, the skin is loose, but whereas in your legs, in your shin of your tibia, if you see front part of your legs, the skin is very much tight, right? So the contraction will also be less, but the area where the skin is loose enough, there will be more contraction. Why? Because the resistance for contraction will be less in loose skin, whereas the resistance of contraction will be more in the areas where the skin is tight or it is thin, right? So for example, at shin of the tibia, the contraction of the wound will be less comparatively in the gluteal region. This is clear? Okay, so now skin contraction is greatly reduced. I have already completed this point. Okay, so now remodeling phase, what is going to happen? There will be role of fibroblast which have their contractile elements called as myofibroblast, and these myofibroblasts are going to contract the wound so that the size of the wound is decreased. So now we have completed 3 phases, right? It was so easy. I'm feeling that you guys are also understanding, right? If you are feeling bored, just try to watch it again, right? There is no solution apart from watching it again and again or reading it again and again. Okay, I'm not saying that you watch my videos again and again, but any topic or any concept which you are not getting in a single go, you just try it again. You're not getting again, just try it again, but it will surely happen. Okay, so now we'll move on to our next phase, that is the phase of scar formation. So now the wound has healed. Now the top layer of the skin will resemble as a scar, right? So as we know, there is abundance of fibroblast and collagen. Now new vessels, that is capillary budding, took place in the very first phase, right? So there are new blood vessels still in the center or in the internal area where the wound has freshly healed. There is still some amount of deposition of epithelial cells going on, right? And along with that, a lymphatic channel. So everything is getting re-established again and again. So the top layer of the skin, right, which is a bit modified after the experience of a wound or after any tissue injury, right, there is a modified structure of skin which is again replaced. Eventually that will also become normal, but it takes time. So that process is known as scar formation or cicatrization. So remodeling of this area, ultimately with the help of collagen, fibroblast and various other elements, will take place and lead to formation of a scar. So that is the end of wound healing. All the four components of wound healing, from inflammatory phase to phase of scar formation. So these are the four main components of wound healing. Now if you want to refer the healing by primary intention or healing by secondary intention, that is in your second year general path, you can just watch this video and surely read that topic from that textbook. You will surely understand it. And for the surgery, this much is enough if it is asked in your exams. So this was the end of components of wound healing, all the four components of wound healing, and the end of lecture 2 of general surgery. I am really sorry to all the viewers that I am not able to upload the videos on a continuous pattern, so that in a rhythmic pattern, right? But I'll surely come back to the normalcy, and I'll start uploading videos very regularly and rhythmically, right? So if you enjoyed my video, then please like, share and subscribe our channel. And there is also one important announcement which is to be made, that is I'm conducting my second webinar on complete denture series, right? So the second webinar on complete denture series is dated or scheduled on 28th July 6:30 p.m. The registration forms are on our Instagram page, that is Dentistry to the Point. You can just check out our bio. We have put the registration forms. Register for the webinar. It is just a short 1 hour webinar. The title of the webinar is Diagnosis and Treatment Planning in Complete Denture, right? So this webinar is going to be mainly useful for undergraduate students who are just blindly making complete dentures in the 2 years of their clinical learning, right? So in your third year as well as final year, it is very much important to first know what is the reason, what are the basics behind fabricating a complete denture before moving on to the process of fabricating the complete denture. Okay, so with this I'll sign off, and I'll be sure that I'll upload the next video, that is third part of general surgery, which will be on factors affecting wound healing as well as complications which are going to occur at the time of healing of wounds. So I hope you guys have understood this topic and enjoyed the video. If you really enjoyed this and if you like our content, then please share it with your fellow colleagues so that they also get an enough chance or an equal opportunity to gain this knowledge. Thank you so much. Take care. Bye bye. Stay safe.